mechanical imbalances can cause breakdown of the spinal joints. That is essentially what we're trying to correct in the office. Remove those mechanical imbalances so you can live a healthy, pain-free lifestyle and be active throughout your life, not just be sedentary. Okay, got Gail in the office today. We're going to give him a full spine adjustment. Sinuses, right, Gail?
Mm-hmm.
He's got a little bit of leg discrepancy. He's got some pelvic misalignment. We went over that a bunch. 2 iliums, your sacrum, this triangular bone in the middle. The iliums kind of go back and forth with the sacrum as like a fulcrum. Those joints, those SI joints, can get stuck in either extension or flexion or even rotation. So we do a lot of drop work to take out that pelvic unleveling, to take out that pelvic rotation, and just sort of get things back in alignment. Okay? If you leave it go, your pain may come and go, but it's going to lead to further degeneration, further decay, further breakdown of the joints, especially the discs of your low back. So people go in and get an x-ray or an MRI later in life and they're shocked that their spine is so degenerated, or sometimes it's not even later in life. And that's because under the surface, before a lot of pain can brew, or we can just ignore the pain or take something for it, mechanical imbalances can cause breakdown of the spinal joints. That is essentially what we're trying to correct in the office. Remove those mechanical imbalances so you can live a healthy, pain-free lifestyle and be active throughout your life, not just be sedentary. That's the key. You can get out of pain, but you have to ask yourself, what's your quality of life? If you can't move and do the things you want to do, that's not much quality. And that's kind of what we try to help patients in here do, is maximize their potential. Keep their spine healthy. You all decorated, Gail?
Well, some.
Those cookies you brought in were really good, by the way. Thank you.
Oh, you're welcome.
You okay there? Too much?
No, I'm fine.
So his left side was bothering him, so if his left side's tighter, and you can feel the swelling here, I kind of block and then take this to the right a little bit, and that really stretches this left QL muscle, this left SI joint, his left piriformis muscle.
Right there.
And for him, it's kind of more up here. Everybody's built different. Now, Gail has this sharper lumbar lordosis here. So his just natural anatomy is he has this sharper angle down through here. The only way to know that is really to come in and get checked. But that makes him more prone to having stress built up in this upper lumbar spine, like right through here. He's super tight. And part of that's because of the way he's built, the structure of his mid-back. He has this curve. His thoracic kyphosis is just lower. It sits lower. Other people would be more up here. And then he has a sharp, steep angle down. So right through here, he's super tight. So we're going to do muscle work like we do. And then we'll get him adjusted. I can do more after. So we're just getting into his lumbar paraspinals or his thoracic paraspinals, and he's telling me exactly where he feels it. So we're trying to just work out some of the adhesions that build up along your spine. This is going to help him not just adjust better, but hold its adjustment better, because there's going to be less muscle forces pulling things back out of place. You okay?
Mm-hmm, yeah. You found it.
A little bit more. When did you start noticing this again? Just recently, a couple days
Just
ago?
recently, yes, just recently. And I was on the roller bed, and that's when I really noticed that.
Okay, Gil, go face up for me. Face up. Slide down towards me.
Sure.
Take a deep breath. Exhale. I'm gonna come right where it was bothering him, low here, and roll back. Right there. One more. There you go. Let's get his neck and his sinuses while he's face up. Sinus has been bothering you, or for the most part?
Just a little bit.
This helps sinuses drain better.
And it's a big change in temperature, that's what really bothered me.
Okay. You smell that deep blue that I put on it. That'll really clear them out. Okay. Alright, just relax your shoulders here. Nice one. Let that shoulder drop down into my hand. There you go. And same thing here. Just relax your shoulders. Good. Go, stay right there. Traction, just a little pull here. Pick it up. And relax it. So far, so good. Nice. You make sure there's nothing more. Sometimes you get Gail to go second time. Sometimes you don't. Let your head drop, Gail, for me. Good. And this way. Nice and light. There it is. I knew there was another one in there. Go on your side facing me. Sounds loud. Good, you're good, right?
Mm-hmm.
Good, deep breath. Exhale. Good. A little bit there, deep breath. Exhale. Good, I got you a little pull. Okay. I'm gonna do a little more on him because he's so tight in his mid back, which is a tough area to adjust here. But adjustment wise, that's gonna be it. So that's his sinuses, his low back was the focus today, but also his neck too. So thank you very much.